Hi guys, welcome back. So we had a pretty good response from our last time, and I think that we'll keep trying to do this. We're kind of picking topics off the top of our head and from things that patients have recently asked about, but please feel free to write in topics that you want talked about. Some of the things maybe just like labor and delivery and the birth process, or maybe miscarriages, or something totally gyne related, maybe dysfunctional bleeding or irregular periods, things like that. So if you have other interests, please write in and we'll try to do those as you're interested. Anyway, and today I'm going to talk a little bit about postpartum depression. I don't know why I keep picking these topics that are so emotional, but this one is another very emotional topic. And so, again, our sympathies and our hearts go out to you that have gone through this. It's a very difficult thing to go through. So I want to talk to you a little bit about what postpartum depression is, how do you differentiate it from baby blues, what we can do to treat it, and when do we really start treatment, and like future pregnancies once you've had it. So those are some things I want to talk about. This is one of those topics that I can really go off on tangents, so I apologize up front, especially after the long hectic day I've had already. I'm already feeling frazzled. So if I go off on tangents, I'm sorry up front. So first let's talk about what is postpartum depression. And postpartum depression really is a little bit different than clinical depression in that it's very hormonally triggered. And we call it postpartum depression, though the studies have really shown that it starts somewhat during your pregnancy. And so during the pregnancy, I think we tend to just blame it on, oh, you're pregnant, that's why you're feeling this way, that's why you're not sleeping, whatever. And then afterwards it becomes more recognizable. But really, we see it beforehand. And we'll talk a little bit more about that in a minute. So really it's an overall depression triggered by the hormones and the big shifts of hormones that we have. And face it, we all know that hormones make us psycho. And whether we like it or not, it happens. And so this is one of those times. Some of the symptoms of depression and baby blues are the same. Baby blues, about 80% of women have them. It's just this feeling of those first couple of weeks postpartum where you're just overwhelmed. You're like, I can't do this. You feel like you're a terrible mother, maybe breastfeeding isn't going right or something like that, and you're just feeling like you can't do this. And you add that to the exhaustion of having a newborn, and you tend to cry over anything, and you don't know why you're crying. But the difference between baby blues and postpartum depression is that baby blues tends to kind of wax and wane throughout those 2 weeks, and you can cry over nothing, but then you can turn around and laugh, and you can watch a funny movie, and you're still motivated to go do things, and you want to decorate the nursery, and you want to do things. Whereas depression is pretty consistent. You don't have a lot of really good up times. You just kind of lose all of your motivation. So kind of by definition, depression you have to have for at least 2 weeks, these symptoms pretty consistently for 2 weeks. And baby blues, like I say, will kind of come and go, but by 2 weeks it's starting to go away generally. You're starting to feel like, okay, I can do this. You love your baby. And again, I just want to emphasize that because 80% of women or so have baby blues, it's okay to cry when your baby cries for the umpteenth time in the middle of the night. And it's okay to feel overwhelmed, and it's okay to admit that you're emotional, and it's okay to not be like totally in love with your child the moment it's born. You know, these movies and Facebook blogs and things that say, oh, I just loved my baby. Well, that's not always normal. This is a stranger that's moved into your house, and sometimes it takes a minute to get to know them. And so that's okay. Those are normal feelings. You don't have to have this euphoric, oh, I love being a mother moment the moment this baby comes out of you. That's actually not that normal. It's usually, what am I going to do now? And I am so tired I can't even think about that. So those are normal things. You start getting 2-3 weeks past your delivery and you don't really feel like doing anything. You don't feel like getting out of bed. You can't sleep well. Even when the baby's asleep, you're not sleeping great. Your appetite can either increase or decrease. People that tell you funny things and you're like, haha, you know, it's not funny. You just don't find a lot of joy in things. And your poor husband can start taking the brunt of it. You're like, you hate him. I mean, what is it? He did this to you, or it doesn't matter. He just breathed wrong. And that's all postpartum depression. And most women that come to me kind of really recognize it because they're tired of yelling at their kids and yelling at their husband, and they're tired of being grouchy. And kind of what I've given you is the real classic diagnosis for depression. you know, the apathy and the diet changes and the sleep changes and the feeling suicidal and just feeling depressed. But postpartum is actually a little different than that. You can feel all those typical classic depressed symptoms, but you can also feel a lot of anxiety, a lot of, you know, you're afraid for your baby, you're afraid for your other kids, and you know it's irrational anxiety, but that anxiety is definitely a part of postpartum depression. And we see depression on a spectrum. We see depression like on this end, and then on this end of the spectrum is anxiety, and over here is actually OCD. And I've definitely had patients that have gotten into that really almost psychotic OCD aspect where they won't let anybody touch the baby, where they can't sleep, where they can't put the baby in a grocery cart, where they're washing their ceilings, things like that, where clearly on this end of the spectrum, but it's all a spectrum of the same process, the same disease. So some women feel really depressed, but some women just are angry and anxious, and they think, well, this can't be postpartum depression. I'm not depressed. I just want to kill my husband, or I just want to you know, have my baby next to me all the time. I don't want anybody touching it. I don't want anybody else holding it. That's all part of the same spectrum. So when do you know it's a problem? The problem is when it starts interfering with your life. So when you can't go grocery shopping, or you can't function, or you're interfering with your relationships that you already have, your husband and your other kids, then it's a problem. So that's when you need to start saying, okay, what am I going to do about it? About 20% of women have postpartum depression. And in any other form of any other place in the world, something that happens to 20% of the people is going to be considered normal. So you have to understand it's incredibly common. Not that everybody talks about it. To tell you the truth, I think most of my patients talk about it more in hindsight. They say, I think I had it with my last baby. It took me a long time to get over it. But you feel almost guilty because you're supposed to love being a mother. You're supposed to love your baby. It's supposed to be awesome. And so you don't really want to talk about it, even though you're struggling. And so just know it is so, so common and so normal at 20% that you don't feel like it's anything bad. Your hormones have thrown you off, and it just is something that needs to be treated. If I told you this in another way, if I said, oh, your thyroid has been thrown off by your pregnancy, you'd be like, oh, give me some thyroid medicine or treat my thyroid. Make me feel better. And that's really the same thing. Your serotonin is thrown off by your hormones, and we just need to fix it one way or the other. So let's talk about fixing it. And when do we start treatment? So with depression and anxiety, you can really treat it in several different ways. The one that you always hear about is the medication. And we use medication a lot because it works. And it works fast. And it works in the privacy of your own home. And so when you're already feeling anxious and depressed, you don't necessarily even want to leave the house. And so it's nice to just be able to take a pill. Nobody else knows you're doing it. And it feels good sometimes just to be private about it. And so the pills are probably the thing that we go to most. The safety of pills in breastfeeding actually has been shown to be quite safe. And it's interesting to show that kids that are raised by moms who aren't treated often have more side effects, more effect of the depressed mom than they do being exposed to the antidepressants in the breast milk. And so there's a pro and con to both sides. And so if you're breastfeeding, or regardless, if using medication is what's recommended and what you want to do, I would have no guilt over that whatsoever. In fact, I'd be proud of you for doing something that you know is actually for the benefit of you and your spouse and your other children, as well as your baby, that you are brave enough to do that, to admit to it and get treatment for that. The typical medication that we use is what's called an SSRI, a selective serotonin reuptake inhibitor, which is your Prozac and your Celexa and your Lexapro. They tend to work great. They tend to work fairly quickly. They tend to have very few side effects. And so that's why we use them. They work and they're pretty easy to use. Sometimes we have to use a couple different ones to get the right one for you. And we almost always have to use higher doses for the anxiety OCD component of it. For some reason, depression tends to respond better to a lower dose than anxiety and depression. So we usually start with the same dose, but you kind of plan on that you might need a little higher dose to get rid of the anxiety stuff. And these aren't long-term. The idea is that we put you on it until your hormones kind of go back to normal, and sometimes that's after you're done breastfeeding. And so it can take a little while, but sometimes it's just 6 weeks or so, and then we take you off, and it just kind of gives you that boost back up. So we're not, putting you on a lifetime, regimen of an antidepressant just because of this one episode. What else about the SSRIs? That's probably the most important things about those. The next thing is exercise. Now, it's hard to exercise when you're postpartum and you've got other kids and you've got a newborn. But the exercise releases that serotonin as well, and it works quite well. And I also think that it's really good for you to start doing something for yourself so that you're not a baby carrier and now a baby feeder. You are a woman who has her own needs, and to get out and do something for yourself for half an hour every day has multiple benefits. You get the serotonin release from the actual exercise, but you also get that validation that you're worth it. You're important. You're still a human. You still need some needs, and you're worth a half an hour to an hour a day of your own private time. And I think that does not neglect your children. In fact, it reinforces your relationship with them, plus teaches your other children some really important things about taking care of yourself, and that you've got to take care of yourself before you can take care of anybody else. So I love exercise postpartum, and you don't necessarily have to wait till the 6-week check. A lot of times people say don't do anything, but if you feel up to going and getting on a treadmill or on elliptical or something, if you feel up to it, go for it, even if you haven't had your 6-week check yet, as long as your pregnancy's otherwise been pretty normal. The last treatment is counseling. Counseling works great. We have counselors in our office. There's lots of counselors in the community. It's really been shown to be as effective as the medication. It just takes a little more time. You have to be a little bit more open. The thing I like about counseling is that you'll learn tools and instruments, ways that you can self-treat your anxiety and depression, so that when you are 3 months out or 3 years out and you start feeling it come back again, you can use those tools again without necessarily seeking medical help. It empowers you to take care of yourself. And so most of these visits are a 2 to 3 week, 2 to 3 visit counseling sessions that just give you some tools to use so that you can self-talk, work through things yourself. We know that women that have an underlying depressive disorder, that if they aren't treated throughout their pregnancy, it's like 78% of them will have a depressive episode during their pregnancy. So there's a high chance that if you're not being treated, that you'll have it. On that note, I do want to talk about when do we start treatment, because I said earlier that we call it postpartum depression, but it really starts in pregnancy. So in pregnancy, if you start feeling like you're not doing great, or your husband tells you you're not doing great, that's probably the best time to start treating it. So we would start treating maybe even, just the last month. There's a lot of literature out there about the safety of taking these medications in pregnancy. And currently the thoughts are, for everybody that's studied this, that the risks of not treating depression in pregnancy are greater than the risks really of taking the medication. So we try not to take anything in the first trimester if we can, but after that, if you need it and we start you on it, it's going to be a much different postpartum experience than if you wait until you're really depressed. And in all honesty, in my experience, you have a lot shorter treatment period of time than if you wait until you're in extremis, really. I've had patients that have, hurt their child. I've had patients that left them by the road. I've had patients that have, just done crazy things. And then trying to get those women back to a normal state takes much longer than if we had treated them when they first started getting symptoms. And then it's just kind of a short treatment. We get you through the hormone changes, and you're back to normal. So hopefully as normal as women ever are. So those are kind of my thoughts on that. So if you start to notice it in pregnancy before you deliver, it's still considered part of that whole postpartum depression thing. We'd still treat it. What else? I do want to make one little note to husbands. For all of you Tom Cruises out there that think women can just get over it, you can't. That'd be the same as telling somebody to just get over their appendicitis or get over their thyroid problem. You can't. It's not something that you can always self-talk yourself out of without, counseling or medication. And so give your wife some slack. Give her that half an hour every day. Sure, maybe she can take the baby with her when she goes on the walk, but take the other kids. Let her have that moment. She is worth it. And your relationship is going to be so much better if you give your wife a little bit of chance to recover from this huge emotional roller coaster that women go through at this point in time. She's exhausted, she's tired, her hormones are wacky, she's leaking from every orifice, and she's not feeling sexy. And just don't make it about you, husbands. Make it about her and give her a chance to get through this. And she'll get back to normal. She'll be back to the wife that you married at some point. But just, give her cut her some slack. All right. Questions, Sam?
Yeah, we've got a few.
Okay.
Shaylin is wondering, how long can postpartum last? And can it go in spurts? Can it intertwine with depression and go back and forth between depression and postpartum?
Exactly. So depression tends to come in episodes, and most women that get postpartum depression are at risk of getting just plain old depression, of course, and vice versa. And so if you've had depression or long-going anxiety, a lot of my patients will say, I think I've always been a little anxious, that absolutely postpartum will magnify that, will accentuate that. And then you can do well for a few months and then maybe dip back into it. Postpartum is really just considered the first 6 weeks or so. I personally can see it up to 9 months afterwards, and I still consider that all postpartum. But once we start getting a few months out, then it's really just considered depression. Either way, we treat it the same. And if you've had a history of depression, we absolutely watch for it closely in pregnancy. And I would jump right on it just so that you have, again, a shorter episode, so that hopefully by your 6-week visit we can get you off your meds and be done with it. But yeah, depression, if you're kind of predisposed to it, will wax and wane kind of throughout your life regardless. Yeah.
All right. Cassie, she said, can you have postpartum, but you don't, your feelings aren't towards the new baby, they're towards your other children?
Absolutely. Absolutely. And it's so weird. Postpartum depression. My sister's a counselor, and I've talked with her a lot about depression, and she's never had kids, and so I've always told her that the hormonal depression is so weird compared to just clinical depression. Clinical depression is kind of textbook, like you say, you have these things, but postpartum, man, you can have the strangest thoughts and the strangest feelings, and directed towards the most random people. Usually I see it directed towards your husband, but absolutely I see women that get really irritated with their other kids, or their kids just won't leave them alone. There's no rhyme or reason to who gets the brunt of it, in all honesty. And again, a lot of times it's not recognized as depression because you just think, they're just driving me crazy, I'm not depressed. But when you start realizing that those relationships are being threatened by it, then you've got to step back and say, wait a second, maybe this isn't them just being bad because they're kids and they can only be so bad. And so that's when you step back and say, okay, maybe I'm overreacting, maybe this is my demonstration of postpartum depression comes at that, but absolutely can be directed at anybody.
Great. Amy is wondering, what are some ways to avoid spiraling down when you're dealing with postpartum depression and your normal daily responsibilities and or things with your children that aren't going the way that you want?
Yeah. Again, and so most people... well, first, if you go to counseling and learn some of those tools, those are some of the things that you'll use as some of those self-talk tools that they give you to keep you from spiraling down. Exercise is huge. And I really believe, too, in getting outside to exercise. I mean, at least trying to see the sun, going up out of the inversion. There's just something about being outdoors that is good for the soul. And so, even if you just go for a walk every day, but that would be the number one thing. And if you see a lot of people that are like really active, dedicated fitness freaks, a lot of them have anxiety and depression, and they know that that is the way that they're going to stay sane. And so their motivation isn't necessarily weight loss or running a marathon, it's to keep sane. And so that would be the number one thing I would say is get your exercise.
Great. Mackenzie says, how long can it last? I felt like it went away pretty quickly with my first baby. I didn't need any medication. My second is just over 2 years old, and I feel like I'm still struggling. Was on Prozac and Wellbutrin for about a year and didn't notice much of a difference.
Yeah, I mean, the goal, the hope is that, the goal is that the depressive episode would be 6 to 9 months. And that's all depressive episodes, not just postpartum. It would be 6 to 9 months at the longest. Some women need things longer, and in that case, we're not necessarily looking at a depressive episode, but more of just a long-term depressive personality. You know, you have depression, in essence, and it will wax and wane, and sometimes you'll feel better, but you might have this underlying depression. So those are the women that kind of need to be either on a really regimented exercise program or on medication. And that's fine if you have to be on medication for the rest of your life. You know, we wouldn't hope that for you, but it's okay if that's what it takes. So, Prozac and Wellbutrin are great drugs. There's a million, not quite a million, but close to them out there. So if you didn't quite feel that those did it for you, definitely try other ones. Try different doses. They're all they all have their own little special niche, and what works for you might not work for your mother or your sister, but if you try different ones, sometimes you'll find just the right one that you're like, And the goal of the depressive medicine isn't to make you feel, they're not happy pills. We're not trying to make you, all, rosy and happy. We want you to be normal. We want you to be angry when it's supposed to be angry and frustrated when you're supposed to be frustrated. We just want you to feel normal. That's all. We do not want you to feel flat. Some women will take antidepressants and then they don't feel anything. And most of my patients would say they'd rather feel depressed than feel nothing at all. So that is not the goal. If that's happening with the medication, we need to try something different.
We've got one last question. Noelle, it's a good question. She said, can you develop postpartum or OCD if you've adopted a baby, especially if you've had it with biological children?
Well, we wouldn't call it postpartum in the sense that your hormones have shifted, but I think you can definitely get a depressive episode. The lack of sleep, for one, can definitely throw you into one. Plus, your brain is really good at creating pathways. And so if your brain associates newborns with depression, it can definitely pop you right back into that. So you add the fatigue and the exhaustion plus the newborn baby. The baby crying. So you could have a little bit of shift in that. It wouldn't surprise me at all if your periods, skipped a period or whatever. And those are all signs that your hormones are kind of messed up. But I think I don't know that I would label it postpartum depression as much as I would label it kind of a reactionary depression. Still treat it the same. We would still do the same thing.
Okay, great. Can birth control help with the depression and anxiety?
That's a great question, and that's true. Again, pregnant or not pregnant. Postpartum depression, again, as soon as we get you back onto normal hormones, it's easier for me to treat the depression. And I've had patients, as hard as it is, that I've said, you've got to quit breastfeeding. We cannot get you through this. And these are patients that are actually kind of dangerous at this point. I'm like, you've got to stop breastfeeding. And the funny thing is, half the time they don't listen to me. And it's not until their pediatrician tells them to quit that they're like, oh, my doctor said I could quit. And I'm like, I've told you a million times to quit. But once you kind of get back into normal cycles, often I can then finally get the antidepressants to work better for you. Outside of pregnancy, we've looked a lot at like PMS and depression, and even though we know it's hormonal caused, the treatment with hormones doesn't always work to fix it. It would make sense that it doesn't, but it doesn't. The antidepressants work way better than hormones to treat even hormonally caused depression. So even in PMS, we use antidepressants before we use hormones, and menopause.
All right. We've got some more coming. Jessica says she's been on Prozac for about 4 years, and she's felt great the entire time that she's been on it, but she just had a new baby who's 2 weeks old, and she's starting to feel a lot more depressed than usual, even with taking her medication. She said, do you think I need to be seen to try something new or adjust the dose? She says, I'm breastfeeding, so I'm a little bit nervous about changing.
Exactly. And again, I want to be really cautious about treating you guys on this, but often, even if you're on medication, you'll have to go to a higher dose postpartum. Again, you get those hormonal shifts, and we just need a little bit higher dose. So you probably should call your doctor's office and make sure, but what I would say is go ahead and go up to the next dose. So if you're on 20 Prozac, go up to 40, and then and just see if that gets you through it. And then once things kind of stabilize, we drop you back down to 20. But it's always better to maximize the dose of the drug that you're on, especially one that's worked for you, one that the baby's always been exposed to, rather than change drugs and expose the baby to yet another one. Now, you have to remember, when I say exposed, the amount of antidepressant that's in the breast milk is minimal compared to what they got across the placenta, and really haven't seen blood levels in babies. So it's in the breast milk, but we don't really see it affect the baby that much. So if you have to change meds, don't stress over it. But yeah, I would, if you're my patients, go up to the 40s and then call your doctor and just get a follow-up after that to be sure that it's working before you get too far under the gun. So, all right. So I need to go answer that phone call. And so please write in. Tell us what other topics you want to do. I'm a little scared. They keep wanting me to do topics like home deliveries and versus hospital deliveries and myths, and I don't want to be totally crucified on Facebook. But if I get into some of those hot topics, but yeah, send us some topics and we'll go through those as much as you want. Thanks, guys.